Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist, and it is time for another CHT prep video. We're going to go through 10 free practice questions that can help with your studies for the CHT exam. So the way that this works is we're going to go through all 10 questions. I'll read out the multiple choice. Go ahead and pick an answer, do your best. If you need to pause the video at any time to do so, that's fine. And then we will go back through all of the questions with the best possible answer for each question that is available and the rationale for that as well. So without further ado, let's get into this video. Question 1. The capsular pattern of adhesive capsulitis is as follows. A. External rotation greater than internal rotation greater than abduction. B. Abduction greater than external rotation greater than internal rotation. C. External rotation greater than abduction greater than internal rotation. D. Abduction greater than internal rotation greater than external rotation. Question 2. Which of the following goals of therapeutic intervention is not appropriate in management of carpal instability? A. Increasing range of motion to equal that of the contralateral side. B. Maintain wrist stability during functional activities of daily living. C. Pain and edema management. D. Achieving functional range of motion of the wrist to promote ADL participation. Question 3. How would one perform a flexor digitorum superficialis test to determine function of the FDS muscle? A. Hold the PIP joint in extension and ask the patient to actively flex the DAP joint of the affected digit. B. Hold the other digits in full extension and ask the patient to actively flex the PIP joint of the affected digit. C. Hold the other digits in full extension and ask the patient to actively flex the DAP joint of the affected digit. D. Hold the MCP joint in full extension and ask the patient to actively flex the DAP and PIP joints of the affected digit. Question 4. A 35-year-old patient presents to the clinic 5 days after a thumb MP ulnar collateral ligament repair. The surgeon has recommended early active motion. Which of the following interventions would be most appropriate to initiate at this initial therapy visit? A. Active range of motion to the thumb 4 times a day. Fabricate a forearm-based thumb spica-orthosis with the IP joint of the thumb free. B. Fabricate a forearm-based thumb spica-orthosis with IP joint of the thumb free. PROM to the thumb is tolerated. And edema management. C. Fabricate a hand-based thumb spica orthosis with the IP joint of the thumb free, fine motor coordination practice, and edema management. D. AROM to the thumb 10 times every hour, PROM to the thumb 4 times a day. Fabricate a thumb spica orthosis with the IP joint of the thumb free. Question 5. Which of the following is not true regarding the juncturae tendinum? A. With digital flexion, the juncturae tendinum glide distally with the extensor tendons. B. The juncturae tendinum provides stability to the extensor tendons over the MCP joints dorsally. C. Between the extensor digitorum and extensor indicis, there is a juncturae tendinum. D. The juncturae tendinum function to transmit tension between the tendons of the extensor digiti minimi and extensor digitorum communis. Question 6. In assessing a patient with an EMG study that shows severe carpal tunnel syndrome, you notice the patient has full strength of the flexor pollicis brevis, abductor pollicis brevis, and opponens pollicis with manual muscle testing. What could explain this finding? A. Berrettini anastomosis. B. The patient has anterior interosseous nerve syndrome. C. Risch-Kenyu anastomosis. D. The patient has Wartenberg syndrome. Question 7. An extensor tendon injury in zone 4 would involve which of the following structures? A. PIP joint. B. Proximal phalanx. C. MCP joint. D. Extensor retinaculum. Question 8. Which of the following tests can be used to diagnose central slip injuries? A. Wartenberg sign. B. Cosen's test, C. Elson's test, D. Jean's sign. Question 9. Between what degree of MCP flexion is the extensor tendon most unstable after a sagittal band rupture? A. Between 25 to 35 degrees of MCP joint flexion. B. Between 60 to 90 degrees of flexion. C. Between 45 to 90 degrees of MCP flexion. D. Between 30 to 60 degrees of flexion. Question 10. What degree of extensor lag is considered a poorly gliding tendon in extensor tendon repairs? A. 20 degrees. B. 30 degrees. C. 50 degrees. D. 60 degrees. All right, nice job, everyone. You made it through all 10 questions. Go ahead and pause the video if you need to go back and look through your answers. Make sure that you feel committed to them, because we're going to go back through all the questions and I'm going to go through basic rationale for which of the multiple choice options is the best available answer. Question 1, the correct answer here is C. The capsular pattern for adhesive capsulitis would be that external rotation is going to be limited more than abduction, more than internal rotation. The correct answer here is A. For management of carpal instability, the focus should really be on a pain-free functional wrist, not necessarily increasing range of motion to equal of the contralateral side. We want really that pain-free functional range of motion. Question 3, the correct answer here is B. Option A would be, kind of testing the FTP function. Option C is not really anything. And option D includes both FDS and FDP function, as well as it can be an indicator of lumbrical tightness. And the claw position is a lengthening exercise for lumbrical tightness as well. The correct answer here is A. You're likely going to start with active range of motion as well as a protective orthosis between exercises. It's a little too early probably for passive range of motion, though you could talk with your surgeon about possibly active assistive, and then you would want to focus on edema management, active range of motion, and pain management and protection of the repair. For question 5, the correct answer is C. The juncturae tendinum are intertendinous connections that are relevant with our extensor tendon anatomy. All of these are true statements other than C. There is not a juncturae tendinum between EDC and the EIP or extensor indices. Correct answer here is C. The Risch-Canu anastomosis is a connection between the ulnar nerve and the median motor nerve in the palm, which would preserve those muscles and also would have a positive EMG study for carpal tunnel syndrome. Question 7, the correct answer is B. Zone 3 is going to be the PIP joint. Zone 5 would be over the MCP joint, and Zone 7 is over the extensor retinaculum. Correct answer for question 8 is C, Elson's test. The Wartenberg sign is a sensory branch of radial nerve sign. Cosen's test is for lateral epicondylitis or locis, and Jean's sign is an ulnar nerve motor sign. Question 9, correct answer is C. The extensor tendon will sublux, usually ulnarly, over the MCP joint, and it's most unstable between 45 to 90 degrees of MCP flexion. Okay, and question 10, correct answer is C. An extensor lag of over 45 degrees is considered a poor gliding tendon with the Miller scoring system. All right, everyone, that is it for this month's CHT prep with practice questions. These are all written by me. I am not affiliated or associated with HTCC. And thank you so much for watching. I hope this video was helpful. Let me know if you have questions, comments. Feel free to reach out, comment below with any suggestions of other content or videos that you would like to see in the future. And I will see you in the next one.